Good afternoon. My name is Carmen Wabagijik-Nuchtai. I am the Director of Health and Community Wellness for Tikmikshing and Anishinaabeg. Welcome to our health Q&A for this week. We do hold these every 2 weeks, and today is November 5th at 3:25 p.m. On our panel today, we have Marina McCumber, our community health nurse. We have Amanda Wabagijik-Jourdain, who is our health promotions manager. And then we have Rachel Pattison, who is our health programs manager. We have Bridget Prowse, who is our communications officer, and she's in the background and recording this for everyone. So welcome, and we'll start off by just letting you know that our state of emergency has been extended. Our current one expires on November 30th, but we have extended it to January 31st of 2021. And this extended measure will allow for flexibility for creating and implementing measures for the safety of the community. We'll now move on to our statistics for today, and we'll have Marina do that.
Good afternoon, everyone. So the statistics as of today regarding COVID positive cases in Tikmikshing, we have no new cases. And we have one resolved case. For public health Sudbury and districts, we have 3 new cases reported today, as well as 3 new cases yesterday. Total number of confirmed cases so far in Sudbury are 133. Of those cases, 124 are resolved, and we've had 2 deaths so far. Total tests that have been performed for COVID-19 are 93,202. And for the Ontario province, they're reporting 998 new cases today. And in the past week, cases have been over 100 provincially. Confirmed cases so far provincially, 80,690. And the resolved cases are 69,137. In the news, we're hearing that a lot of areas are have gone to stage 2, and they have higher number of COVID-19 cases. In our order, found on the website, there are areas identified as locations that if you travel there, we will have you self-monitor for 14 days. Now, the hot spots in Ontario are Toronto Public Health, Peel Public Health, York Regional Public Health Services, Ottawa Public Health, Windsor Essex County Health Unit, and Durham Region Health Department. So just want to let you know that if your family are coming home for a visit from any of these areas, please advise them that they must self-monitor for 14 days and practice all guidelines such as physical distancing, wearing a mask, washing their hands, and yeah, we have to do whatever we can to mitigate the risks of COVID-19. Now, I'll pass it off to Rachel.
Hi, everyone. So just to continue with what Marina was talking about with the province, as of November 7th, which is next week, 2020, the province will be transitioning the public health unit regions to a new framework for identifying COVID priorities. We're going to talk about what those priorities are later on in our Zoom today. Though this framework, just to start it off, this framework identifies the Ontario priorities, which the framework identifies Ontario priorities with regards to COVID, which are limiting the transition of COVID-19, avoiding closures, keeping schools and childcare centers open, maintaining healthcare and public health system capacities, protecting our vulnerable populations, and providing additional supports wherever possible. Amanda?
Okay, so there are several risk factors that help drive transmission of this or the spread of COVID-19. So those risk factors are close contact, closed spaces, crowded places, forceful exhalation, and prolonged exposure. Close contact is the highest risk. Limiting these risks is critical in keeping Ontario open and safe. personal and public health measures such as physical distancing, staying home even when ill, even with mild symptoms, frequent hand washing and surface cleaning have significant benefits and have been proven to limit COVID-19 transmission. It is critical that we understand the risks of gatherings in close contact in enclosed and indoor spaces to understand how to mitigate those and make informed choices.
So we'll move on. Principles for keeping Ontario safe and open in the framework are responsible, proactive, graduated, and responsive, and evidence-informed and clear. So just to give you a better definition of what these are. So responsible is meaning protecting the health and safety of the people of Ontario, especially those who are most vulnerable. Keeping childcare centers and schools open are priorities. Proactive, graduated, and responsive is proactive measures, including enforcement. Will work to prevent transmission, thereby protecting our healthcare system and helping businesses stay open. Graduated measures should be targeted and informed by regional circumstances. Evidence-informed means best available scientific knowledge, public health data, defined criteria, and a consistent measures will inform public health advice and government decisions. Clear. Clear means plans and responsibilities for individuals, businesses, and organizations, so employers, will be clear and outline what happens at each level. Marina? Oh, you're on mute, Marina. It will be at the bottom left side. Yeah, there you go.
Just bear with me. I got to pull up the document. In the framework, outbreaks and community transmission is described as outbreaks can start in a variety of places, including workplaces, institutions, and other settings. When there are a few or small number of outbreaks, public health units can undertake aggressive outbreak management at each setting to contain virus spread. This may include rapid case and contact management, enforcement of measures, and strengthening measures where the outbreak is occurring. If spread of the virus is not contained, it often results in widespread community transmission. Widespread community transmission requires broader scale responses. A response would include broad scale public health measures, restrictions to restricting access to control transmission, as well as testing and case contact tracing. Community transmission can result in further outbreaks, including in vulnerable settings, such as nursing homes. When this occurs, targeted actions, particularly in vulnerable settings, such as long-term care homes, retirement homes, childcare centers, and schools, are required to prevent illness and death. These outbreaks can also lead to further community transmission. Rachel?
Hi, just to continue on, adding to what Marina and Carmen was describing, in this framework that the province is going to be implementing next week, they have identified a system that will either adjust or tighten public health measures. These levels are defined as prevent, protect, restrict, control, and lockdown. They are described as follows. Prevent, which is a standard measure. This will focus on education and awareness of public health and workplace safety measures. I'm going to start over. The prevent standard measures will focus on education and awareness of public health and workplace safety measures in place. Restrictions reflect broadcast allowances of activities in stage 3, absent of a widely available vaccine, or in absence of a widely available vaccine or treatment. The highest risk setting is remain closed. The next level that the province is proposing is protect, is a strengthened measure, enhanced targeted performance, fines, and enhanced education to limit further transmission, applying public health measures in high risk settings. The restrict or intermediate measures is implementing enhanced measures, restrictions, and enforcement, avoiding any closures, implementing a broader scale of measures and restrictions across multiple sectors, and to control in order to control transmission. They can return to a modified stage 2. Restrictions are the most severe available before wide-scale business and organization closure. Control, more stringent measures. This area would implement a broader scale of measures and restrictions across multiple sectors in order to control transmission and returning to a modified stage 2. Restrictions are the most severe available before a wide-scale business or organizational closure. And the last section is complete lockdown. Implement wide-scale measures and restrictions, including closures to halt or interrupt transmission and returning to a stage 1 or a pre-stage 1. And this is a considered declaration of an emergency. Sorry, Amanda, you're next.
Okay, so the goal is to have every public health unit region in the prevent level. Measures are scaled back or implemented progressively level by level. If trends are improving, measures are dropped cautiously level by level to ensure there are no significant community or public health impacts with the rollback of measures. So please ensure that you and your family practice all measures when leaving your home.
Okay, thank you. So that does describe the framework. And what I just want to reiterate is, this is going to be implemented on the 7th, and we just want to prepare the community. We use public health as a guideline in order to put any measures into our community. And all these considerations will be completed. What our community does is we have a response team that meets twice per week. We also have an assessment team that reviews all of the stats locally, regionally, and in the province. And now we will be reviewing this area as well. So as long as public health Sudbury and districts, they will identify in their website what level we are at. And when they are at a green level, then, we will continue with the education. So if it does progress, that's when we will begin other restrictions. So I just wanted to let you know that. Now, Marina's going to talk about the high dose flu vaccines. Marina.
Yeah, so I just wanted to mention, and I'm sure a lot of people have heard in the news about the shortage of flu vaccine. Now, there's 2 flu vaccines that we had at the health center. Quadrivalent, which is for 6 months to age 64 years. And then we had high dose trivalent, and that's for 65 and over. So what's happened is we have a quadrivalent available, and the high dose that we were supposed to get was diverted to long-term care homes because of how vulnerable they are. So my apologies that we do no longer have any high dose vaccine, but for anybody wishing to get a flu vaccine that is 65 and over, you can safely have administered the quadrivalent vaccine. So my apologies, and everybody stay safe. And also looking at this new framework identified by the province, I'm happy to say that we're in the first stage, which is prevention, even though we do have some cases in the area, but we are still in that category.
Okay, so thank you, Marina, for that. And if you do want your flu vaccine, give Marina a call. Also, we have Kim Reckley, who can coordinate through Rochelle Patton, the nurse practitioner. We also have pharmacies that are available for giving out flu shots as well. And I am aware that Battistelli's pharmacy does provide that service as well. So you have many different options. Okay, so that concludes this week's health Q&A. Thank you for joining, and we wish you a great week and a nice weekend, and we'll see you in 2 more weeks. Miigwech. Palmapi.
Palmapi.